students come here not just expecting to participate in service learning and in the community interaction that UCSF is known for. I actually think in a better way, students demand that UCSF make that commitment and that their experience and what they see and feel at UCSF is consistent with that.
Prime US is the program in medical education for the urban underserved, and it's a program that tries to train doctors to be advocates and agents of change, in addition to serving the health needs of some of the communities in San Francisco and other cities with the poorest health outcomes.
Glide Health Services is located in the Tenderloin district of San Francisco. So a lot of patients are underserved, they don't have housing, they might have drug addiction or substance abuse, psychiatric illnesses that are not treated or poorly managed. A lot of these factors can hinder many of our patients from receiving the care that they really need.
CDC stands for Community Dental Clinic. It's a student-run organization that has student volunteers and faculty volunteers. We provide free healthcare services to underserved populations around San Francisco.
Science Squad is a group of pharmacy students that volunteer at Rosa Parks Elementary School and expose 4th and 5th graders to various science experiments.
Different students learn in different ways, and Science Squad helps students realize what science is outside the classroom and relate it to their daily life.
Carry the One Radio is a series of short interviews with different scientists, and our goal is to make it so that they can explain their science in a way that a layperson could understand.
So we decided to call the show Carry the One Radio because first we liked the math reference, but also we liked the idea of picking up someone, lifting them up to understand science and make it such that this is something that they can also do.
My first experience at UCSF was as a visiting 4th-year medical student at San Francisco General Hospital in the emergency room. And I remember so well starting to get from patients what it was like for them at home. Whether or not they had 2 jobs to make ends meet, working the night shift, and it had a profound impact on me thinking from a traditional doctor-driven orders and directions to hopefully being much more of a listener, having more compassion, and a deeper understanding of how someone's life in their community impacted on their ability to keep themselves well.
One thing that Prime has taught us is that there's no medication for housing or for lack of access to healthy food or danger being unsafe in your home, but there is a lot of healing that can be done when a doctor just accompanies a patient as they face those challenges and walks alongside them and tries to advocate for them in whatever way is possible.
I went in the program thinking I was going to learn a lot, and I did, particularly for my patients. It's really humbling. And it gives you a different perspective when you take some things for granted that my patients may not have access to. It makes you reflect about your own life and your situation.
One of the reasons I became involved with Community Dental Clinic is because I myself had an underserved background, and being able to understand where they're coming from is really what drives me to be able to provide for this cause.
When I got to UCSF as a graduate student, I realized that there were too few minority students in research, and I wanted to do something about that. And I realized that radio might be an easy way to get the science out there and make it more accessible to anyone who wants to listen.
Because the more people we have kind of giving into the conversation and contributing to the conversation, we can really build better science.
Our students, our faculty, our staff are making a commitment to this city and this community that is part of how we should show up as a public institution.
I definitely hope we're having a positive effect, and I feel like we are, because every time they see us, they're so excited. And the 5th graders especially, they've had us for a whole year in their 4th grade. And when we ask them questions that we had talked to them about before, they remember the answers to that.
Being part of the clinic does take a lot of hours. It's a lot of hard work. But what makes it all better is when you have a patient that comes to you at the end of their treatment plan and tells you that you did a great job and that you've just helped them out so much and they can't thank you enough for what you've done for them. All those hours and all the stresses and frustrations just all go away, because that's really what it's all about.